go ahead and get started. So welcome everyone to the webinar on child welfare and early childhood, cross-systems collaboration to improve outcomes for young children and their families. This is sponsored by the BUILD Initiative and the NCIT Capacity Building Hub. I am your moderator for today, and my name is Cynthia Tatum with the BUILD Initiative. And this is our fourth webinar. And the topic for this webinar is Head Start and Childcare for Children in Child Welfare. Slide, please. So the objectives of this entire series taken together are to raise awareness about young children and their families encountering or involved in the child welfare system, to educate participants about the racial disparities in family separation that comes about as a result of child welfare involvement, to promote opportunities and strategies for prevention for families and communities, and to provide examples of cross-systems collaboration on behalf of our youngest children. Thank you. So for this webinar today, these are the objectives. One, we want to understand the benefits and challenges of enrolling foster children into Head Start programs. And the second is we're going to hear from, we're fortunate to have, in fact, two Head Start parent leaders about their experience in Head Start in West Virginia. And then we're going to learn about California's Emergency Child Care Bridge program. And then we're going to have a discussion about how the staff of all three systems can work together to successfully provide these beneficial programs to especially vulnerable children. So we have our presenters today are Tommy Sheridan, Deputy Director, National Head Start Association. Tommy, want to introduce yourself to the people?
Yes, absolutely. So excited to be here with everyone today. Look forward to the conversation.
Thank you. And with Tommy, we have Skylar Jones and Courtney Tomes. Skylar and Courtney, would you introduce yourselves?
Hi, everybody. My name is Skylar Jones.
Hi, I'm Courtney Tomes. I'm excited to be here with you guys today, too.
I'm Trilla Cobb. I'm the Early Head Start Program Director.
Thank you. Thank you for being with us. We have also Susan Savage, PhD, Research Director, Child Care Resource Center in California. Susan?
Good morning or afternoon. I'm so happy and pleased to be here today. Thank you very much, Director of Research at Child Care Resource Center.
Thank you, Susan. And finally, we have Andrea Zaverl, Research Manager, Child Care Resource Center in California.
Hello, everyone. I'm Andrea Zavril, a research manager at CCRC, and I helped lead the bridge evaluation.
Great. So thank you all. Can we go to the next slide? We're very happy to have everybody, and we're particularly excited that we have our parents from West Virginia joining us today. How to participate. So this is for you guys in the audience. First, go ahead and introduce yourself in the chat. People like to know who else is there. Like if we were actually in person and we were in a room, you could look across the room, you could see who you know, your friends would introduce you to other friends, but we're not. So the best thing we can do is introduce yourself in the chat, and then we can see who's here and say hello to you. Okay, we're starting. Melissa Becker, welcome. And then we're going to have a poll coming up very shortly, and we're going to ask you to go ahead and fill out and answer the poll questions. There are only 5 of them, takes no time at all, and we'll go over the results of the poll with everyone. Okay, everybody's introducing themselves now. This is great. Welcome, everybody. And then as we go along, we want you to put your questions for the panelists in the Q&A or in the chat. So what we're going to do is that we're going to hear from everybody first, and then I'm basically going to speak for you, the audience. So we'll take your questions, whether you put them in the Q&A or in the chat, and I will ask the questions for you of our panel. Okay, sometimes if you put a question in the Q&A and it's for a particular panelist, they might be able to answer you directly. And then at the end, we have a survey that's basically your opinion of how the webinar went. We appreciate everybody taking just a couple of minutes to complete that survey because we do need feedback on how we're doing. And it helps us to improve ourselves as we go along. So speaking of polls, here it is. So this is the poll. Everybody can just fill it out. We want to know what sector you work in, how well you understand the child welfare system in your state. And this is just your evaluation of how well you understand your system. We want to know if you're aware of any change efforts that are currently going on in your state that are targeting children who are involved with the child welfare system and their families, of course. Children don't come without families. And does your state have a formal agreement between Head Start and the Child Welfare Department? I know my state, I'm in Chicago, Illinois, and I know my state has had one for some time, finds it very helpful. And does your state provide emergency childcare for new foster families? So these are the questions that we putting there. Hi, Judy King. Seeing people pop up here in our chat and welcoming you as you come. You can just do the poll, and when we have enough people who have completed the poll, I'll go over the results for you. Dina Evans from Illinois, welcome. Aloha from Hawaii, Chris Jackson, awesome. Nancy from California, welcome. Donna Emmons from Illinois, welcome. Okay, are we about ready for the poll results? Okay. So it looks like about 46% of you are in early care and education, and another 28% in other early childhood programs. This is pretty consistent with all of our webinars. We do have 14% of folks who are in child welfare and 12 who are adjacent to child welfare. So that's great. We have the majority of people, 43% understand some about the child welfare system in their state. Another 29 understand a little, and 22% understand a lot. And we have 2 experts in our audience, so awesome. We hope that you are still, even if you're an expert, that there'll still be something here for you to learn. Okay, so do you know of change efforts that are going on in your state? About a third almost, roughly, yes and no, and not really sure. Which is fine. And does your state have a formal agreement between Head Start and the Child Welfare Department? 23% do. Only 5% do not, but 72% are not really sure. So this is something you can go back to your state and find out. Does your state provide emergency childcare for new foster families? 38% said yes, only 6% said no, but 55% also not sure, something else you can go back and find out about. So thank you so much for completing the poll. We have a sense of who you are. And because you introduced yourselves in the chat, we have a sense of where you are. So thank you very much. We're going to move on now. And I'm going to turn it over to Tommy Sheridan from the National Head Start Association.
Great, thank you so much, Cynthia. And I know the slides, I think, are just loading up there. And so excited for this opportunity to talk with everyone. Let me start by just seeing all of the names in the chat and the various organizations and things by saying just a big thank you to everyone on this group, and maybe those of you who didn't enter your names, and maybe I don't mean to thank you, but I think I do, because we got a group of folks that care. That are part of this conversation, and that's really clear to me when I see all the various programs, all the various organizations, and I find that really empowering and really exciting to be having this conversation with all of you. You can go to the next slide. I wanted to really talk a little bit about more specifically about Head Start's role in child welfare, and hopefully, and this is my goal here. Hopefully we can inspire you to reach out to local Head Start programs, whether it be your state collaboration office. I see Corey on here from Louisiana, a good friend of ours on that space, or whether it be to local programs. Because of course, Head Start's overall model is a little bit more, it's a little bit unique compared to a lot of other federal programs where the funding goes directly to community-based organizations. That has a history in the civil rights movement, that has a long history in reasons why we've operated that way, and it allows Head Start to access and serve children and families in ways that we probably would not be able to. But it also does lead to some challenges with coordination and collaboration, and that's something that I can guarantee you the Head Start community is interested in trying to work with you to address and to figure out how we can move forward. Because at the end of the day, we're all here for the same reason, which is to improve the lives of children and families and to really support those who do that hard work. So from my perspective, who I am and why we're here speaking today. So I'm Tommy at National Head Start Association. Our organizational vision is really to lead and to advocate, to lead basically being the untiring voice that will not be quiet until every vulnerable child is served with the Head Start model of support. I emphasize those words, model of support for the whole child, the family, and the community, and then essentially advocating to make that happen. Next slide. Our organization as a whole, we see the Head Start field really as the biggest strength that we have, and that what we bring to the table is lifting up the voices of Head Start staff, of Head Start parents, of Head Start directors, of Head Start alumni, and looking to engage to ensure that we can lead to ultimately to healthier, empowered children and families and stronger, more vibrant communities. You can go to the next slide. I'm really flying through these because I want to focus on like two slides, that's it. But you're going to have these for resource afterwards, so that's why I wanted to have them. So for those of you that don't know a whole lot about Head Start, I think it's important to start from the beginning, which is where Head Start was created, and that was the Economic Opportunity Act of 1964. That, of course, came from President Johnson's address to Congress shortly after he became president, after the assassination of President Kennedy. And really, he used these words, and I think these words fit our conversation perfectly, that we must open the doors of opportunity, of course, but we also must equip our people to walk through those doors. And that is something that Head Start, I think, has really drawn into its model, because Head Start is not just about what happens in Head Start classrooms. It is about the entirety of the program. It is about support for parents. It is about whether that be parent training programs, fiscal, financial resources trainings, whether that's about making sure that they have access to health services or that their children have access to health services, whether that be about healthy nutrition or about the actual education and the role that parents can play. And it also, of course, has to deal with the children, equipping them with the skills that they need. And I think because of that history, Head Start is primed to be a partner in serving children connected to the child welfare system in a variety of different degrees. You can go to the next slide. And I think that through that lens and through that vantage, looks like my formatting got really confusing here, so sorry about that on here. The slide I'm looking at has like 3 more bullet points on there, so I'm not sure what happened, but we'll make sure to correct that and get whatever's out there. But I think from that perspective, it's important to acknowledge that Head Start needs to be a partner and should be a partner in the foster care systems in your states and in your communities. Currently, Head Start serves, and this is actually the most recent number, some of the more recent pre-pandemic numbers. And I included these in particular because that shows where we were pre-pandemic. Things have changed during the pandemic, of course, in child welfare, but also in Head Start. As class sizes have had to be reduced, as families have been a little bit more scared of bringing their children into facilities and things of those kind. But at that point, Head Start was serving about 35,000 children who are currently in foster care. They also had referrals from over 22,000 children that have been referred directly from child welfare agencies. Now, to put that in perspective, that's a pretty small amount of overall Head Start. Head Start in general serves about 900,000 children a year. And those numbers, and that is from prenatal to age 5, that the services provide. Now, Head Start does have, though, and Head Start has very specific eligibility requirements that allow us to serve some certain populations and focus on children and families that have specific needs and specific challenges that they're facing, such as poverty, such as families experiencing homelessness, such as families who are connected, or such as children, excuse me, who are in foster placement. And so per the Head Start program performance standards, that's that HSPPS definition up there, children are eligible for Head Start if the child is in foster care. Now, I included a slide on the next slide, which you don't need to go to yet, Ingrid, but on the next slide that you can use that defines what does in foster care mean, because that is important, right? And it means slightly different things, and that's part of the confusion for all of us, but there is some more specifics on that. But the point I'm raising with this is that it is something that is encouraged, it is required, and it is something that we actually need your help to do a better job of. It's also something that throughout the role of Head Start and the Office of Head Start, who oversees Head Start, sets our rules, they continually encourage children and families to be part of and partnering with child welfare systems. Within grants, this is starting to get to the points where you can't see, but applicants must include in their grant proposals how they plan to meet the needs of children in foster care. That is a required piece per the federal statute that authorizes Head Start. Programs are also allowed to reserve slots. They're allowed to reserve up to 3% of their slots can go unenrolled for a certain period of time, specifically for children in foster care or children and families experiencing homelessness. And that is important because Head Start normally has very strict requirements around enrollment. Now, pandemic world is a little different than that. We're having a little bit more flexibilities, necessarily so. But the bottom line is that it is encouraged and strongly recommended that Head Start programs really go do extra work to make sure that we can provide services to children in foster care. We also have had several pieces of guidance that have come out from the administration. I linked to 2 of them in these slides, which again, you'll have access to, and you can see there about partnerships and also about kinship care. The partnership piece came out in 2010, something we still are using. The kinship care actually came out pretty recently. I think it's well, I say recently now, but time is relative. 2018, 2019, in that time frame, around that is really encouraging Head Start programs to go out of their way to serve children in foster care. Next slide. The reason why we're so invested in this, and the reason why, and this is the definition slide, by the way, that you can have. I promise you on my screen, the slides here, it's a Google Doc into PowerPoint format. They look amazing. It looks really pretty. There, you can read the text, unlike the black here. So apologies for that, and we'll figure out how to get to that one. You can go to the next slide, Ingrid, as well. But the reason why we're talking about this, and the reason why we're wanting to focus on this, is because the results and the research are incredibly strong. Head Start and Early Head Start programs provide opportunities for children to receive developmental health and nutrition screenings. As you all know, approximately 50% of all, I'm reading on the slide here, 50% of all young children in foster care exhibit developmental delays. And that's precisely what Head Start focuses on, that broad gamut of delay, wherever that may be, whether that be something that is seen through child development, that's something that is seen through a learning disability, through speech and language, through other types of things. Head Start has those systems baked into the overall program design, and that is precisely why we are, why we're, I think, a perfect place to partner with and to serve children in foster care. We've also seen studies that have shown how early Head Start children have significantly fewer child welfare encounters. So if you are engaged in the Early Head Start program earlier, you're less likely down the road to be to have any sort of encounter There's also different types of abuse that are detailed in that report that's there. And I think the strongest piece of research is the piece that came out a couple of years ago in 2017 that looked at children who had child welfare referrals but had not been placed into foster care yet. And it tracked them based off of their early learning experience. And Head Start was children who are referred to Head Start or went to Head Start were 93% less likely to be removed from their homes and placed into foster care than those without any early childhood education. That was actually the only program that was statistically significant for this study. And this was an early study. They were looking to continue on and detail more, but that is precise. That makes sense. It makes sense because Head Start provides those parent training opportunities. They provide the improving. We work specifically on improving parent involvement in relationships, and ultimately are focusing on decreasing caretaker distress. Right? It's that model of understanding. How can we ensure that families can be in a position to succeed? How can we break down some of those barriers? How can we help them set goals? Whether those goals be about they need to find a job or a car to be able to get to their job. They need to be able to do this, whatever that may be. That's what Head Start is there for, to partner with parents and help them realize the supports that they want for themselves and the life that they want for their children and for their families. No, I could go on and on and on about the successes of Head Start and ramble on here for a while, as I already have. But instead, I thought it would be a wise idea. And Cynthia and I, while prepping for this, said, what if we actually brought in a couple Head Start parents? So I reached out to my friend Trella down in West Virginia because I know that the program they run is absolutely exceptional, does some really, really amazing work. And she invited our two parents to come and join. So I'm going to turn it over at this point to Skylar Jones, who's a early Head Start mom, I believe, or Head Start parent. And Skylar, I'll let you take it away and turn it over to Courtney next.
Hi, everybody. Thank you for having me today. It's an absolute honor to get to speak to you guys. I've been a part of the home visitation and Head Start program since December. I currently have an 8-year-old daughter, and I'm pregnant with my second. For me personally, the program has been completely life-changing. During my first pregnancy, I struggled very badly with prenatal depression and postpartum depression. And whenever I was first approached by the program, that was another one of my main concerns. Now I live 2 hours away from any of my family, and I was really worried about just having somebody there to kind of keep me in check of, are you feeling okay? Are things going the way that they should be? And that's one of the things that this program has really done for me. In January, I started to get really depressed again. And having a program that comes into my home every single week who knows me and knows my daughter, it was very easy for them to recognize, hey, are you feeling okay? And, it's not just like, do you have everything that you need for your baby that's coming? Does your daughter now have everything? It's mentally, are you okay? And luckily, they were able to recognize very, very early that I was not. I went 2 weeks where if I made it from my bed to my couch, I was like, this is a really good week. And at the beginning of the program, I was very concerned with, that picture perfect mom. Every time they came into my home, like, was it clean? Am I dressed? Did I take a shower this morning? And when my depression hit, my visitor came in and I was wearing sweatpants and a t-shirt, and honestly, I probably hadn't showered in about 4 days, and she looked at me and she was like, how are you feeling? And I just said, sad, and I don't know why. And I sat on my couch and she sat there with me as I bawled my eyes out, and I couldn't even tell her why. And the first thing she said to me was, let's talk to your doctor about this. And to have somebody there for you, just to sit on the couch and listen to you cry and hold you and, make sure that you can follow through and tell your doctor what you're feeling, has been completely life-changing for me. Had I not had her or this program, things could have went very differently for me at that point because I felt so low. Aside from my own mental health, they've got to know my daughter who has ADHD and who is autistic, and they've brought programs, like we do a cooking class that we go to every week together, and that gives us our time together. And the first cooking class, my daughter wouldn't even raise her head. She tucked it into my arm and hid her face and was so shy and so, just to herself. And now my daughter is the one that is going from table to table to table to make sure everybody has all the supplies that we need. And she's the helper, and she wants to pack everybody's food and everybody's bag. And this program for our family has just been completely life-changing, just, aside from making me feel better, to giving us things to do together, to helping to work on her deficits, which come in, on the communication and interaction side of things. And just to have a family that I know if I need something, if I call my visitor, if she's not there, I can call her boss. And if she isn't available, I can call Courtney, and I know that she will help me. So it's just been completely life-changing to have this support of people behind us to make us better parents and to show us that you don't have to be picture perfect and be on cue, and you can be in sweatpants and your hair up and not shower in 3 days, and we're still going to sit on the couch and put our arms around you, and it's going to be okay. So for me personally, that's how it's really just impacted everybody in my family. So at this time, I'll turn it over to Courtney so you guys can hear her story.
Nice to meet you guys. I'm Courtney Toms. I'm an emotional mess now, but hey.
It is okay.
I just resonated with everything that she said. Like, I went through the same thing with the depression, the postpartum depression, after I had my now 2-year-old. But she was there for me while I was pregnant, when I had him and everything. And it's just, yeah, he's a pandemic baby. I had him right at the beginning of the pandemic. He was a turkey baby. He was born on Thanksgiving of 2019. And just everything that she said, like Virginia and Case period, they're just there for us anytime we need them for anything. And I always feel comfortable with Virginia coming, no matter what I look like, no matter what. If I'm crying, bawling my eyes out, she's there. And it's helped my son a lot. Like we were just talking about a few minutes ago, like at first when Virginia came, my son would be like, hiding and shy and like not want to play with her or talk with her. And now he runs to her and he's like so excited to see her and see what they're doing for the day. And I also have a daughter that went to Head Start and stuff too before she started school, and it helped her a lot. She's in 2nd grade now, and it was really helpful with her too. So seeing how it helped her, I definitely wanted to put my son in it too, because I know it'll help him. Well, it's already helping him with the social skills and everything, so it's going to be great.
Wow, Skylar, Courtney, thank you so much. I think you're getting all of us a little emotional as well, and I can just say, more than anything though, I mean, these are the types of stories that I think just remind us about what it's all about. It's about that, what can we do to support parents in being there and being present for their children, right?
Everybody supporting everybody.
That's exactly right. Because the love that you have and the excitement and the dreams, right, that you have for your children is something that all of us can relate to. And it's something though that sometimes other things in life get in the way of that, right? And that is why we as communities, as organizations, as Head Start, as child welfare programs, that's our end goal, is to make sure that we can have that families can feel supported, that they know where to turn in times of challenge. And I don't know if you're seeing the chat, but you're getting a lot of love from all over the country, and a lot of appreciation. So I just want to say thank you to both of you one more time for joining us and telling your stories as you did.
Very welcome. Thank you guys for having us.
Yes, thank you.
Of course, of course. Well, I'll wrap up with a much more boring finish to this, but I think that is precisely the point, right? As they just showed, is that it takes a community, and a lot of our families feel disconnected from community, and from family, and from other types of things, and that is precisely what Head Start and Early Head Start can do. I should have started this at my presentation, but whenever I say Head Start, I'm referring to Head Start and Early Head Start, and Migrant Seasonal Head Start and Early Head Start, and American Indian Alaska Native Head Start and Early Head Start. It really is a broad community. But I think there's more that we can be doing. And this is really what I want to challenge us on, and excited to hear the childcare side of things and then turn into a conversation. I think that there is there's so much more that we could be doing. As I shared on there, we're talking about 35,000 children in 2018. Now that number has decreased throughout the pandemic. It has gone down quite a bit. And I think that there's opportunity for us to serve even more children and families moving forward if we can build some of that types of alignment at the state level, at the local level, at the community level. And I think there's some special areas that we really need to put some focus on too. Number one is this first question. Head Start has done a focus on kinship care, so on understanding that if mom or dad is not able to take care of their children, maybe aunt or uncle, grandma, grandpa can step in. But there's a lot of examples of informal kin care arrangements that I'm sure y'all are familiar with. Situations where mom or dad may not want to report their son or daughter for having substance use challenges or struggling with depression or whatever this may be. And therefore they take care of the child, but it's not a formal relationship. Therefore, can they formally enroll in Head Start? And the answer to that is no in a lot of situations. And so how can we do a better job of identifying and supporting children in these informal kin care arrangements? Head Start programs have started treating children as though they are experiencing homelessness in this situation under McKinney-Vento definition of homelessness, which is what we use. But I think that there's other policy and potential other policy solutions, that we could potentially leverage and use. I also would say, what changes in Head Start eligibility do we need for better services? We talked about foster care. Foster care eligibility is one. But what about child welfare referrals? What about the opportunity of trying to get in more on the prevention side as we're seeing Family First move more towards that prevention approach? What could Head Start do, and what changes could we see in Head Start to do that? And that's something that our community is certainly talking about extensively. A point that came out of the Sasha Klein piece, this is the one that had the 93% figure in it, was, how can child welfare agencies actually do a better job of gathering information on what programs children are attending, whether that be childcare, Head Start, pre-K, whatever, and work with them to directly connect or refer to Head Start and Early Head Start in that space. And then I think the broad question that we're still kind of looking at, and we're making some progress, and then the pandemic hit, but was how can Head Start better align and connect with Family First? And I'm not talking about the Families First, the funding bill that had a bunch of funding for pandemic relief, but I'm talking about the child welfare side of things, which I think y'all are familiar with too. So I very much, and you can go to the last slide, I put my contact information on here. By all means, please feel free to reach out. Very much look forward to this conversation. And I cannot stress enough, just a major thank you to Skylar, major thank you to Courtney and to Trella for helping them all be here today too, and look forward to the conversation. Thank you, Cynthia.
Thank you, Tommy. And I want to give also a special thanks to Skylar and Courtney. I don't know if you guys were able to see in the chat, but as Tommy said, you're getting a lot of love and support and encouragement from all over the country. So we really appreciate your being willing to share your stories and your feelings, because this is really why we're here. So thank you so much. Stick around, we're not done. We're going to go, next to Susan Savage and Andrea Zavero, and they're going to talk about California's Emergency Child Care Bridge program.
Thank you so much. And thank you, Tommy and Skylar and Courtney, for your stories and the courage to tell them. So greatly appreciate your time. Today, we'll be talking about the Emergency Child Care Bridge Program in California. And I want to thank our funders, First Five California, First Five San Bernardino, Heising Simons Foundation, and our partner at California Department of Social Services, as well as all of the agencies across California, the parents and the providers, the child care providers, who gave us their time in this study. So I really appreciate all of their work. Next slide, please. And I want to recognize our wonderful team of researchers who worked on this project. Next slide, please. So this is a timeline in terms of the actual project that was launched statewide. We received a call from LA County Department of Children and Family Services saying, we are having the most difficult time placing children age 0 to 5 in foster care arrangements. And a lot of these foster parents are relatives, sometimes older. They need childcare because they have to go to work the next day. And we can't place these children. How can we work together to make this happen? So a group of state advocates worked for a budget ask. And in that year, the first year was not successful. So we tried again, try again. And in 2016, we gained a little more momentum and we were able to launch a pilot to test what's needed in this situation to help ensure that these parents are able to say yes to taking those children. Also, along the same timeline, the Bridge program was adopted in state legislature in October 2017. We launched the Bridge program statewide in early 2018, and we at CCRC gained this funding to do a statewide evaluation of the program. Next slide, please. Now, thinking about these intersecting barriers, these barriers occur in both childcare and in foster care placements. Placing children age birth to 5 it's really hard. There's childcare deserts. Again, foster parents, I'll take a school age child because at least they're, have some place to go half of the day. Sibling sets, multiple children, also difficult to place in both childcare and in foster care. Many of these children require a 12-month full-time care placement, which makes a Head Start placement that might be part day, part year, really challenging. But you also heard from the prior panelists about the importance of Head Start and how that program really offers something unique for these children. So we need to really think through that. Many need non-traditional hour care. Parents work evenings and weekends. How do we maybe think about something that will wrap around a Head Start program to offer those evening and weekend hours? Childcare programs have limited enrollment periods. You heard about Head Start. You might have a small window, other childcare programs, small window of enrollment time, and often long wait lists. So next slide, please. The Bridge program has 3 components that we found were important when we launched the pilot program. First off, these families need money for childcare. Childcare is insanely expensive. So ensuring that they have the voucher is really important. Childcare and child welfare are systems that are siloed and very complex traditionally. So families, where do I find childcare? Which childcare location is open? Do they speak Spanish? I don't have time to do this. I got to set up my home to take in the foster child. So having a childcare navigator to interview and say, what are your needs? I will find that childcare location that meets your needs. That's critical. Trauma-informed care training and coaching for the childcare providers to take those vulnerable children, also critical. You want to ensure that childcare program is trauma-informed. And in terms of the statewide program and evaluation. Next slide, please. What we did is we launched this evaluation statewide, and we looked at 12 different counties, very unique counties, small, large, urban, suburban, rural, some implementing early, some implementing mid-range, and some later. Each had such unique instances And we had lessons to learn from each of these counties that worked with us. Next slide, please. In the evaluation, we were able to conduct 124 administrative interviews, which included line staff as well as leaders on the child care side, the child care resource and referral, and the child welfare side. 52 caregiver parent interviews, 57 child care provider interviews, 346 parent caregiver surveys, and over 600 child care provider surveys as well. Next slide, please. So I'm going to turn this over to Andrea to talk about the caregiver findings.
And we'll go through this quickly, but there is a report that's included. So if you want more details, you can go into that. The first goal of the Bridge program was to, as Susan said, to increase that likelihood that a resource caregiver, relative caregiver would accept a child into their care. And we asked caregivers, and 40% said that they would not have accepted the foster child without access to the Bridge program. And so they really needed that financial assistance to be able to take the child. In the interviews that we did with caregivers, and I use the term caregivers as an umbrella term for resource parents, relative caregivers, foster families. So when we talked to caregivers, those that said would not, when we dug a little bit deeper, it was because they needed, they couldn't take multiple children or infants because of work in the childcare issue. Those that were unsure had conditions in which they would accept the children, and so many of it was that school age condition of I'll accept school age children because they're in school, but I can't figure out childcare for those under 5. And then those that were a lot of the relatives who said, I would have accepted the child no matter what, their family, and we would have figured it out. But that has a caveat too of you figure it out for a little bit, but then what happens if you can't figure it out? And that's where you see the replacements where the child is placed multiple times with different caregivers. Next slide, please. One of the second finding, but was really big was, I think the word we heard the most from caregivers was that the Bridge program was such relief to have this program available, and just saw a major stress reduction due to the program. 96% of caregivers agreed that just access to childcare overall in general was a reduction in stress. And then they also talked about a reduction in economic stress and a reduction in emotional stress. And one caregiver has a quote where he says, when the family has stress, the child has stress. And so talking about that stress reduction really changes the environment in which the child is in, and is a huge benefit. Next slide. We asked caregivers if they noticed any changes in their children while participating in the program. And a lot of the changes that were mentioned are really important for this community who's experienced trauma. And so 93% said maintaining a consistent routine was helpful for the child, which is big for children that have been removed. They said that they were able to build strong bonds with a child care provider. So having strong bonds with another adult is really beneficial. And then 78% noticed positive changes in the child's well-being. Children were thriving socially, cognitively, and physically by being in quality childcare. Nobody said that there was negative changes. The 20-ish% that didn't notice a positive change, it was either because they only had the children for a few weeks or months when we spoke to them, or because they had infants and it was hard for them to see changes in infants when they're 3 or 4 months old. Next slide. We also talked to the child care providers and asked them if they noticed differences in the child well-being, and 82% agreed that the program increased the child's well-being. And they mentioned a lot of the same factors that the caregiver saw: having that consistent routine, being able to explore and learn and with peers, and then having a social life was really important and beneficial for these children. Next slide. Another finding, and this is really around that second component of the Child Care Navigator that's a part of this program, is we heard over and over again that this Child Care Navigator was really key to the family's success. Caregivers agreed they were coordinating timely placement with the child care provider, getting quality child care referrals, enrolling in the Bridge program was easy. The Navigator took care of all that bureaucracy and red tape. And again, we saw that the Navigator reduced their stress levels. Having that person that you can ask your questions to, that can explain all the different programs, I don't know if we mentioned before, but the Bridge is a time-limited program. So it provides 6 months of childcare vouchers with an extension to 12 months if needed. And so another role of the childcare navigator is to enroll parents and caregivers into long-term subsidized childcare. And so having somebody to manage all that paperwork and explain was really beneficial for caregivers. And I have a note here too, because when we talked to those navigators, we interviewed the navigators as well. And the role, that staff role, the experience needed is both on the childcare, the resource and referral side on how to make those quality referrals, that connection with the childcare providers in the community. But they also need to have the knowledge of the childcare voucher programs and what the children are eligible, and having a connection with Head Start too to understand and make that link was really important. And here at CCRC in our program, because one person didn't have all that knowledge, we ended up forming a multidisciplinary team where one person from our subsidy program, our voucher program, one person from our resource and referral program, and one person from our Head Start program meet weekly to discuss the Bridge cases and see which programs are eligible for what resources are most important for the families. And that's really helpful in getting families linked to the kind of childcare that they need. Next slide. So we also did kind of an implementation study and looking at how the programs were implemented. Next slide. And again, partnerships and relationships building for this kind of cross-system collaboration is huge. When we looked at those that implemented, so the program was made available to counties in 2018. And so we talked to those that were able to jump right on board, and we talked to those that took a little bit, and we talked to those that took a little bit longer. And we found that having established relationships with the partner agencies, that's what allowed counties to jump on board right away. Having open communication and mutual understanding of goals. The goals of child welfare and the goals of ECE are similar, but they're not always aligned. And so we make sure that there's alignment there and clearly defining the roles of this partnership. Also, what came up here, especially in the pilot, was around communication, is the terminology is similar but different. So provider means in the ECE world, childcare provider, where it might mean a caregiver in the child welfare world. Placements, we're talking about placements with the childcare provider in a daycare or a preschool, but they're talking about placements with a family. And so that led to a lot of confusion, and it was really important to meet, build relationships, establish trust to be able to successfully implement the program. And then the last component I'm going to talk about is trauma-informed care. I could talk about this for about an hour, so it's really, really brief. Definitely go to the report, but an important part of the program. Next slide. So trauma-informed care training was offered to child care providers who are serving children in the Bridge program. And we did pre and post kind of assessments on provider knowledge and ability, and we saw statistically significant increases in provider knowledge and ability to care for a child who experienced trauma. And the same is for the TIC coaching, which is the next slide. So training is that kind of the formal, typical, you're in a class learning, then the coaching is the one-on-one for childcare providers. And we saw the same findings. You can go ahead and advance the slide. But with coaching, we found that provider willingness to accept a foster child into their care also increased. And one of the challenges with the trauma-informed care training and coaching programs is that getting providers to participate. There was logistical challenges of the training was offered at dates and times that they couldn't attend. And then there's also challenges getting providers to understand how their child care benefits from trauma-informed care coaching. It was often called trauma-informed care, and that can be kind of stigmatizing, and providers weren't really sure. So about 20 to 30% of Bridge providers did participate in TIC training and coaching, but those that did just found it extremely beneficial, had lots of great things to say, and really felt like it not only improved their care for children in the foster care system, but also just benefited all children. And that kind of tackles that prevention side too, and those resources. Next slide. Oh, and now I'm going to turn it actually back to Susan to wrap up with our recommendations.
Thank you, Andrea. Next slide, please. So what we learned from the parents, the providers, the staff, as well as just kind of reviewing all of the findings in general, was that we really need to extend that voucher. At first, we're given 6 months, many extend to 12 months as budget allows, but also out of county placements. In California, different counties have different childcare costs. And so if you have a lower cost county, you place in a higher cost county, you have to figure out how to budget for that. And this next thing is really important. How can we bring this to the child, have this follow the child, not the parent, so that this child care program is available at reunification with the biological parent? You heard the incredible impact for those who are receiving this service in terms of the foster caregivers. Imagine at reunification or adoption, what this would do for those children who are going back home. Increasing funding to, prior slide, thank you. Increasing funding to allow for expanded eligibility, whether it's more age groups. Often people, counties would start with 0 to 5. Can we move to 12 years old? Most counties do not allow family, friend, and neighbor care, grandmas and grandpas. But if the parent works at hours, evenings, weekends, we need different types of providers. Sibling sets, can we expand to sibling sets, out of county placements, etc. Also funding administrative support. What we are finding out is that what is provided in terms of administrative dollars to implement the program only was attached to the voucher component, not the navigator and not the trauma-informed care training. And so agencies are struggling with being able to continue sustaining implementing this program because of a lack of administrative dollars. So that's something we need to be thinking about and advocating for in California. Next slide, please. As mentioned before, given the tremendous stress reduction due to the navigator and trauma-informed care, the voucher, et cetera, we really need to increase all of the components. We're able to currently increase the voucher, but we need to be really thinking about that navigator component to help find the childcare and then move to more sustainable funding, whether that's alternative payment, a Head Start program, etc., so that we can sustain that piece, especially as you heard, the importance of Head Start. We also are looking at the importance of increased understanding that we have to market and outreach and advertise the trauma-informed care. We heard from providers, well, I would have jumped on board. I didn't know this existed. Well, of course you can't jump on board if you don't know it's out there. And so we really need to ensure that we shore up our ability to advertise, market, outreach to childcare providers in order to get them into the training and the coaching to provide that trauma-informed environment. We also need to think about bridge training for especially social workers. So in ensuring that they are aware of the program so that they can outreach to the parents that need that childcare. We also heard that we want a statewide tracking system to be able to pull numbers across the state and really begin to think about how we can present our outcomes, especially now that this evaluation is winding down. We will need a sustainable way to talk to the legislature about our outcomes and how we're serving these vulnerable children and families. Next slide, please. Implications for Head Start. Child welfare and Head Start relationship building is absolutely essential. Andrea talked about just the time to meet, to communicate, share values, language for what does a caregiver mean? What is a provider, etc. That takes a lot of time. And we found with those early implementing counties that were really successful, they already had a relationship between the child care resource and referral and child welfare programs. We need to be thinking about the enrollment dates. How can we provide wraparound for Head Start, for example? If it's a part day, part year program, how can we connect those families also to providers when they might need evening, full year, full day childcare? We need champions on both sides. We found in the pilot, as well as our evaluation statewide, that when there's a champion on the childcare side and the child welfare side, things go smoothly. There's greater numbers served, and it's just highly successful overall. And again, we really need to be thinking, how do we design this, whether it's through a multidisciplinary team that Andrea talked about, where you have within a child care resource and referral, the Head Start person, the subsidy person, the child care resource and referral person, to then connect that group over to child welfare. So we have that full connection. And that way they can really be thinking about full service for full hours, summer care, et cetera, for these children and families. Next slide, please. Thank you very much. If you have questions, we have our contact information, and I will turn it back over to Cynthia.
Susan, thank you. Andrea, thank you very much. Okay, just want to go ahead and ask everybody if they would put their questions, our audience members in particular I'm talking to here. Go ahead and put your questions in the chat or in the Q&A so that we can ask your questions of our great panelists today. I want to just start by asking the panelists to sort of interact with each other. Everybody had such great things to say, and there was so much content. And I'm just wondering if there was anything that you could ask a fellow panelist about if our child care experts could ask our Head Start experts, if either of our experts want to ask the parents. I just want to know if there's anything you would like to know of each other before I go ahead and start asking some questions from our audience.
From the Head Start perspective, what would ease your mind and the ability to connect in terms of that window? Would it be coming from the Head Start side of, we have this opening for a child and connect to the child welfare program, or would it be more from the child welfare side? What would make that connection easier?
That's a great question, Susan. And I guess I would say, I mean, you can cut this so many different ways, right? And say, well, this. I do think that the data in understanding where children in child welfare are, what types of services they're receiving, I think would benefit the entire system, right? But I think it would really help us to identify how can we do a better job of interacting and of ensuring that children are not left out or left behind in any way, shape, or form. I think Head Start has some clarity in terms of the priority that we need to put on children in foster care. Now, is children in foster care synonymous with children in child welfare? And the answer to that is no, as we all know, right? And so I think that there is some stuff that we can do in that space, or some work that we can do from the Head Start side to further clarify and to further encourage. And let me just give an example of one. So one of my colleagues at National Head Start Association actually is an emergency foster mom herself, and just got the approval, went through the whole process in Virginia, and she had been placed with 2 boys on an emergency basis in her care. And her knowing a lot about Head Start, and she actually helped with this report and knows all the data and everything behind it, and was like, I need to get these boys into the local Head Start program. She goes to the local Head Start program, and they say, oh, well, no, you're coming from child welfare, therefore we need to put you to other programs or to other things or to do this. And that's funded through Family First, where there's automatic funding coming down versus taking up any of the Head Start funding, which I kind of get that, but at the same time, it's this extra comprehensive services that are going a long way. So I think trying to empower programs with from the Head Start perspective of how they are thinking across systems, making it clear that there is a reality that we can provide that Head Start model of support to more families if we can build some of those relationships and connections. Again, I see this more at the agency level than necessarily at the state or federal level. And I appreciate both of you vigorously nodding your heads to that too. But I think that that's something that I would be particularly interested in, is what else can we do to encourage those types of partnerships and supports. Of course, I think that starts with data. That starts with knowing where children are, where families are, and how then can we design systems and build that into our community needs assessments in Head Start, in childcare, in honestly in K-12, in schools, and in so many other organizations to kind of move some of those pieces forward. That would be kind of my answer to that. Can I ask the reverse question of you all as well? Because I think that that's a really poignant, and I mean, what would be that first step that you would want to see?
Well, we were nodding our heads in terms of at the agency level, and what we did find is that those programs that already had that relationship started were able to be a little more successful in terms of making the connection. And so although I do agree that having it at the agency level, money also helps from the state or the federal government to be able to carve out time to meet, to build a relationship. And so if there's a way to add in to funding proposals, more money for collaboration, that agencies could then carve out the time to build those relationships, because that does take quite a bit of time to learn the language, to share values, to understand processes and challenges of each side and constraints that will drive how the two entities work together. I think actually there could be a funding state federal component to add that collaborative piece and shore that up. At the agency level, again, that MDTM model, I think at the Child Care Resource and Referral level agency, and if we can do this at agencies, across the nation, not just the CCR&Rs, to be able to have groups within the agency that actively collaborate on subsidy, finding the childcare, the Head Start component, so that that's active even within the agency, and then be able to your point, connect with each individual child welfare agency. And I'm sure that our CCR&R is not unique in that we have many child welfare agencies connected in our service area. And so again, it's not going to be a one-for-one. So it does take quite a bit of work to collaborate with each of the child welfare agencies. So yeah.
Collaboration is the name of the game, correct? And I, to really the point that both of you made, it is often not supported, like financially, by any system, really. So we have to really make it understood how important it is in order to really improve, just to implement and also to improve any of these services that we're trying to offer to families and children. Andrea, did you want to chime in at all on that?
The thought I had is, again, at the agency level, but I think it's structural with that childcare navigator role, because that's what we saw. We saw a little bit of well, your program has funding and this program has funding. And so we're lifting that off of the parents and putting that onto the navigator to figure out, because parents shouldn't be bouncing around from programs. And so the navigator's that role that can kind of because that's what it is. The goal is maximizing the benefits for the family, but it gets into this tug of war. And so I think we saw the navigator role being the one that can navigate those systems on the family's behalf to really maximize the program effectiveness and all the program funding, but ultimately so it benefits the parents, so they're not being bounced around from all these different programs.
Yes, absolutely.
And just a quick addition, sorry, Cynthia.
Go ahead.
Tommy, you mentioned data. I conducted a project prior to this where we pulled state data of birth records, child welfare records, and our child care data, and we found a significant overlap between Head Start and child welfare. that wasn't really in full awareness of our Head Start program. So, you know, not every child welfare child is known to our Head Start or subsidy programs. And so to your point with data, if we can actually look at the intersection with the data, we can serve more children, more families earlier and more effectively. Sorry, Cynthia.
And prioritize those resources, right? I mean, prioritize where we do our outreach efforts and where those families are. Because oftentimes this, you know, the statistics are there that is the Head Start population is more likely to be connected to child welfare. And so how can we really try to make that the priority and make sure that we're finding those families because we know that we can make a difference if we're able to get them into the door.
Yeah.
Or get into their doors.
Yeah, right. Right. And following up on that, Tommy, I asked a question earlier and I wanted to kind of, bring it to fore here. We put it in the poll, but how important do you think it is for state child welfare agencies to have working agreements, memorandums of understanding? That's what we had here in Illinois, and continue to have, or anything like that, where the issues that arise when workers are trying to enroll children into Head Start. You know, there are particular issues, like kids move around when they're in foster care. You know, their eligibility dates are different. There are issues to be worked out. And I'm just wondering what you think about formalizing some of those agreements in formal, I don't know what you would call it. We call it an MOU.
MOU, yeah. No, Head Start. I mean, and Head Start is required to have MOUs with all of our school districts that we work with, which, as Trella or some of the other directors can tell you, is quite extensive and quite a challenge. And in part of it does, it's important when you're entering those types of conversations and agreements to make sure that there truly is a balance of kind of how people are entering into those conversations and arrangements from a resource perspective, from an influence perspective, and so on. I mean, I think the challenge with that is the challenge that Head Start faces when we're operating with states, right? And that is our federal to local model, which, again, I would continue to argue that is our strength, and that is the strength of the Head Start one of the strongest parts of the Head Start program, but that is something to navigate. I think that's a role that Head Start state collaboration offices can work on. I know that's, for example, in Illinois, that was an area that was a focus. As I said, I know Kari from Louisiana is on was on the conversation. I think he's still there. That can probably speak more about that from the Head Start perspective of how to engage with Head Start state collaboration offices. But I also think that those local MOUs are critical. And if states can find a way, and state agencies, and again, I'm not as familiar with how child welfare agencies are set up. I've seen a couple of instances, but don't know how different they are across states. But if there are ways to incentivize or encourage those types of, I think, more locally driven child welfare agencies with their local Head Start programs, I think that's a really big opportunity. And there's examples out there that we've heard of these types of partnerships and arrangements and coordination that have been very, very beneficial for children and for families. I also think from a perspective of how that's connected to the judicial system and child courts is a great opportunity for programs. I know in Joliet, Illinois, for example, there's some great relationships and connections that go on in that space. So so I think MOUs are always a great idea. It's always good when you can be very explicit about what you're agreeing to and how you can create some kind of processes and procedures. But I also would, and Trella, I don't know if you're in the background down there in the picture, but I was hoping that I might be able to put her on the spot, because Trella is really, I mean, we think about, and Cynthia, you mentioned a comment about making sure when children and families move, as we are talking about largely transient populations. I mean, I remember the stories Trella telling me of the work that they do and the levels of detail they get into in Head Start around making sure that we're following children and working to build those types of connections. So Trella, I don't know, from your perspective as an early Head Start director, what types of things would you want to see to really incentivize or encourage that type of local collaboration, that type of local partnership across, at the state level, at the local level, and so on and so forth. Don't know if there's anything you want to riff on, and sorry for putting you on the spot.
No, it's okay. I just want to add to what Susan said. It truly is about building those collaborations and those partnerships. Just like we have collaborations and partnerships with our families, with our communities, our entire community. But one of the things that we have started doing here at CASE is I have reached out to the social workers and the CPS workers and tried to, like, I've done a little mini training, and then I just went on one of their Zoom calls because they're still not face-to-face, they're still on Zoom as well. So I actually, and just gave them a little bio about our program. I think getting Head Start into the CPS and the social workers and showing that we have this amazing partnership. And I'm going to go back to these two ladies behind me. And Tommy, I apologize, but I said I don't typically share this information because it's really hard to say some of the things we do when we go in a home and when we support a family. And so we were talking about one day Courtney had not had a shower for several days. Her children had been clinging to her, and the home visitor came in and said, took the kids and did the activity with the kids and said, go take a shower, if that's what you need. So that's what I'm saying. When Head Start, I know Head Start, I've been in Head Start for a very long time, like Tommy. It is my heart and soul. And so when I say we go and be above and beyond, I have two women here that can tell you how much beyond we go. We have went as far as to go under a bridge in a local area because someone told us that there was a family there. We were able to apply, and this is what working with your collaborations do. So we were able to work with an emergency service program that helped get that family into an apartment. We got that child enrolled into Head Start, and we didn't have the paperwork. When you work with the homeless population, you don't always have the paperwork. So I didn't have a birth certificate. I didn't have the things, but that's what we did. We found out what state that they lived in, and we applied for that state. Head Start paid to get that birth certificate for that child. So, and this family, once they had safe and affordable housing, then we were able to help them get driver's license and different things like that. They were displaced. So when I say that Head Start, we truly encompass the whole family. We do encompass the whole family. We work with the whole family. And it is, someone said earlier, it takes a village. And I truly do believe that, because Head Start surrounds that family with whatever support it needs.
And we wouldn't be successful without those partnerships, right? I mean, to say
Exactly.
that. And so that's why I immediately go to the local partnerships, but there may be some state level things that I think can really, be is it oil in the gears, whatever it is, grease the whatever the phrase I'm looking for is. You know what I'm talking about.
Especially with like DHHR, because DHHR at a state level is so big, and at a federal level it's so big. So where do you begin? So that does take that national association and the larger programs to come and say, hey, have you heard about this? This program does this. Maybe putting the word about the local programs, maybe having a listing of all the local Head Start and Early Head Start and Child Care Partnership and Asian and migrant. And I'm with Tommy. I truly do represent all of it. We typically, Head Start's the oldest, Early Head Start's next to the oldest. I call us the babies. So we're not even 30 years old yet, Early Head Start. Head Start, they're like 55 now.
Yes.
think that,
Yes, you're so right. I'm just really, I have to tell you this little personal thing. My mother was one of the original parent coordinators for Head Start here in Chicago. So I grew up knowing about Head Start, knowing the importance of it, watching her bring parents together so that they got to know each other and, you know, just trying to think, you know, it wasn't real highly developed at that point. And so there wasn't like, you know, Head Start's got a lot of got models, you know, you got an early Head Start model. There was no model of anything then. She was just making things up. Like, what can I do this week? You know?
yes.
Right.
We do that a lot.
You do that too? So I'm wondering,
Sometimes you have to, but you know, that is another thing, just like you said, we listen to the parents. We allow our parents to have a voice. We
yes.
always want our parents to have a voice.
Well, let me just see if I can put Skylar and Courtney a little bit on the spot right now and ask you if you had advice to give to everybody who is on the line and our experts here on Zoom with us about how best to support the parents and what you think that they could do more of and what they should do less of. And what advice would you give?
You first? I want you first.
I think as far as advice on things that to do better, the program that we're involved in, honestly, I feel is top notch. In my last pregnancy, I was involved in some other type of home visitations that did not come into your home as often as what they do now. I get to see my visitor every single week for, you know, at least 90 minutes. Sometimes we push it to like the 2-hour mark. It's to the point we have to set alarms to make sure she leaves in time because we just have such a relationship together. So just being involved as much as possible and making sure that the people that are coming into your home or that are working with your children are relatable. That's one of the biggest things. The ladies with this company are so relatable that I don't feel any type of judgment at all. I could literally tell them anything. I could text or call them at any point in time, any of them, and I know that they would be right there trying to do whatever it is that they could for me. So for us personally, I don't have any advice because I do feel like we are getting the absolute top notch.
That's what I was going to say too. Like, there's nothing I can recommend that they need to be doing better or anything, really.
They do so much for us, you know, whether it be watching the babies so we can take a shower, or sitting on the couch and holding me so I can cry, or, you know, there was one week I was sick and she brought me body wash and a new toothbrush because she knew I was going to have to change my toothbrush after I was sick. And it's just little things like that that make you just feel so loved and so important, and they really bend and mold their model to make us the best parents that we can be, so we can be good parents.
Yes. Well, thank you so much for that. And so I want to take what you guys just said and ask our panelists, how do you think we can translate what these great moms are saying to us in terms of what's been important to them? How can we translate that to the staff of the agencies that we are looking to be the champions, to do the collaboration? What do we say to them? How do we translate what we've just been told about? I know that was kind of putting you on the spot, but
no, you're good. I'll jump in. I mean, it's in my mind, it's two different things is what I'm hearing. Number one is that they deserve nothing less. I mean, this is the bare minimum, in my opinion, of what we can be doing and looking to support. And the bare minimum is, and I think it was something, Courtney, that you said that I found so important, and it was a throwaway comment that you made about when your family service worker or your home visitor was there and said, if that's what you need. Right, about what's going on right there. That's critical. That is that language that is being used, that is purely about empowerment. I mean, it truly is, of recognizing that this is not me coming in to tell you what you need to be doing. that this is not me coming in telling me that this is how you need to raise your child, or this, that, or the other, which so often I think a lot of families feel in child welfare or in other situations, that they're being told these types of things, and truly being treated with respect, with appreciation, and with a degree of that type of control. In my mind, that is the baseline of what we need to be doing from a broad perspective. And I forgot my second point, but that was the thing that I think we really need to focus. And I appreciated Courtney saying that because I think that's correct.
I was just gonna say that too, we were talking about how we try to spread the word to friends that we know that are having babies or have toddlers, and we try to get more parents in and doing it too, and tell them how awesome it's been for us and how much it will help them,
Yeah. The second thing very quickly is just a reminder. Thank you, Courtney. The second thing is just a reminder that I think every parent wants to be the best parent, wants to be a great parent, right? And this is just another reminder. And how many things do we all have in our lives that we want to be the best at, and we want to be doing this, but we just can't for whatever reason, right? And sometimes we need some support to be able to get to that point. And that was really what I heard in Skylar's story and in others is saying, for me to really be my best self, I need a little bit of help sometimes. And that's what we can do. And that's what we as a Head Start program, as a child care program, as child welfare agencies, what we can really do is building on that recognition that families want what's best for their kids, and they want what's best for themselves as parents. But it's also hard. It's not easy to do. And so that's what, if we can build the support, the system, the infrastructure to provide them with the supports and tools that they need, that's what these stories tell me, is that's how we're going to be successful.
Absolutely. Absolutely. Thank you for that. And thank you, Courtney, for bringing up that point that, word of mouth is still the best outreach, right? Because if your friends trust you, then they'll trust who you trust. And so that makes a big difference. I just wanted to ask, somebody in the chat did ask, Tommy, when you're referring to child welfare, or Susan and Andrew, what definition are we using here? You did mention before, that it's not just foster children, but what are we talking about?
Well, I think it's critical that we define it every time we're using it. And Susan, I'll let you say a little bit more on this space. I think in Head Start, we only serve foster care, right? That is, foster care is the definition that we're using. Now we're exploring and looking for expanding eligibility to be on different types of child welfare referrals and things of this kind. I think it's important to acknowledge that there are also some racial sensitivities and racial injustices and histories of this that we need to acknowledge as we build that type of federal policy out, or changes to federal policy. But I think that to me is something that it's an important question to keep asking ourselves. So Susan, I don't know if you have more, probably have a lot more detail than I do on that.
No, not really. The child welfare statistics show that a lot of calls come in. So something happened, somebody saw something, but those that are investigated and substantiated are so much smaller. And so we need to really be thinking differently about that prevention pipeline. Yeah. So if somebody saw something, somebody made a phone call, but it didn't quite get to the removal into foster care or other programs, we need to build up that 3% of reserved slots for Head Start and other programs to be able to think through a different group. And yes, we do need to fully define what we mean by at-risk child welfare every time we talk.
Absolutely. Thank you both for that. Well, so we're coming to a close right now. I do want to say before we close, and before I pose the final question to our audience members, that the recording of this webinar will be available to you on our website shortly. Tell your friends who weren't able to attend that's available, and they can watch this webinar. And also resources have been provided by both our friends in California and our Head Start friends. So those will all be available on the website, as well as everything from the previous webinars. We have one more webinar on May the 19th on Family First and early childhood. And then we want you, after we wrap and I say goodbye, we want you to still be sure to take the survey at the end and let us know how we did. So I want to ask this final question of everybody whose picture is on the Zoom right now. For your final thoughts, to the audience, what's the last thing that you would want people to take away from this conversation today?
You got some amazing people working right here, Trella and all of them. And this was more exciting than nervous, I think. I was really nervous, but I'm glad I did this.
Oh, good. You were great. You were great. Skylar, you too. You have a final word for us?
Yeah, I just want to thank you guys for inviting us to be a part of this. I think that the work that you guys are doing is extremely important. And it shows just by you guys taking the time to do these type of webinars together to figure out how agencies can all, you know, combine and take care of our families and our children, you know, whether it be foster kid or welfare, you know, just families like us. It shows how much you guys truly care about us. And we, as parents, greatly appreciate the love and support.
Well, thank you. We appreciate you. And I know that Trella and others who are working hard on everyone's behalf appreciate the kind words as well, right? We appreciate it. So Trella, you want to say something here?
No, just that I'm so proud of these amazing moms. They are success stories, but Head Start is full of this. And Susan, I think you made a valid point. It's those children that go the ones in between. And if Head Start could reach those families, that's what we were just talking about. We could be those eyes and ears. We could see this, you know. And one more final thing. Head Start, the reason our model has worked for so long is because we do have standards we have to go by, and they're called the Head Start Program Performance Standards, and they're federally mandated. So we have all of the models. It doesn't matter what model we are. All of the models have to follow the performance standards. Thank you guys for inviting us.
We appreciate you. Thank you so much. Susan, Tommy, Andrea, we have 2 minutes. Final thoughts?
I will be very brief and just reiterate the need for local partnerships for that MDTM multidisciplinary team across the child care, child welfare, Head Start. It does actually take funding. And so if we can help funders understand that they need to provide that support to make a strong intersection for our families.
Absolutely. Thank you, Susan. 1 minute.
My thought was on how do we continue to support the staff doing this incredible work on the ground floor. And one of the favorite modules of the trauma-informed care training is self-care. So it's the self-care for childcare providers and it's the self-care for parents. But I think we also need to focus on self-care for the staff and how to prevent burnout so that they can continue to go above and beyond and support families in this incredible way.
Great point. Tommy?
And I'll just say, I literally was thinking what Susan said, and then I was thinking what Andrea said while Susan was saying it, and so I had to come up with something else. So the only other thing I'll just share, it's always great when you're so aligned in these presentations too, but only other thing that I would just come to an end with is just a reminder, I think, to all of us, because I know these types of conversations, especially across systems, are not as easy as they sound like they should be. And to build partnerships and to find those types of supports, they sometimes are way more frustrating and maddening. But I think it's really important for us in the roles, and by us, I mean policymakers at the state level, local level, even at the program level who are influencing how this works, just to remember why we're there and to remember that we have so many more shared values. And I think that hearing the two stories that we heard today from Skylar, from Courtney, that's why we do what we do. And we want that type of success, right? No matter what your program model is, no matter what where your funding comes from, where it goes, any of those things. And so I think if we can find ways to root all of our conversations in those points, I think we're going to be in a good shape, and I think we're going to do an even better job of serving kids And the last thing I'll just add is just thank you again. Just thank you to everybody on this call for your commitment and your hard work day in and day out.
Absolutely. Thank you so much. Thank you, everybody on the panel. Thank you, folks who attended. Thank you to the comm staff in the background, keeping us running. Just thanks to everybody. Skylar, Trella, Courtney, Andrea, Susan, Tommy, thank you. Bye-bye.